Thank you very much. Good morning, Board. So on behalf of Unite City of Edinburgh Council branch, I'd like to speak to two reports today. The first on system pressures. So firstly, I'd like to thank the Council for the degree of consultation and information provided on the proposals to repurpose Council staff that are working in non-essential services to social care roles. We understand the unprecedented crisis that we face and support the emergency measures and applaud the public sector spirit of all the staff that have answered the call to work on the front line at this time of need. It's imperative that the partnership supports not only the staff adopting these new roles, but the current social care workforce with the challenges that they'll face welcoming new colleagues. These workers may find themselves in an awkward situation of tutoring and leading staff that are grades above them. For taking on such extra responsibility, we ask if there's any further reward planned for this existing social care workforce. I'd like to remind the Board of the principles agreed by the Scottish Government, COSLA and the joint trade unions for undertaking this work. In summary, this is appropriate and early trade union agreement, sharing appropriate data and rationale, engagement with local union reps to support the volunteers, engagement with trade unions in relation to training, line management, PPE, risk assessments and wellbeing, full and early consideration of tasks of the volunteers. With this in mind, we'd welcome an update on the uptake of these posts and the inductions, training and placement of the volunteers. While these principles have been agreed nationally for a specific purpose, similar to the Council's existing policy, yet they've been notable in their absence in some key areas that have been under pressure. One, there are significant changes taking place in ATEC 24, a service that's been unfortunately omitted from the report and the previous one on system pressures. Staff in the Monitoring and Response Service have worked valiantly over the past years under immense pressure due to understaffing. They now face having services call handling being outsourced. This move breaks one of the Council commitments and goes against the desires outlined in the proposed EIJB workforce strategy. It's worth noting the vital role that this service plays helping service users return home and preventing hospital admissions. We appreciate the recent productive discussions we have had with management around the pressures here, but we would seek further assurance from the Board that this service will receive adequate investment to ease the current pressures, ensure appropriate staffing levels, and a guarantee that it will be brought back in-house in its entirety as soon as possible. To close on the systems pressure report, we call on the Board to recognise that the staffing crisis in social care has not been created by the pandemic, but has been exposed by it. This has been a crisis that's been years in the making, years of undervaluing, underpaying and overworking social care staff. Addressing this must be a priority. Audit Scotland's recent briefing on social care painted a damning picture of how staff are treated and of how the commissioning model for social care services pushes down working conditions and rates of pay while also sacrificing service quality. The Board must sit up and take notice of these important findings. The next report I'd like to speak to is that of the workforce strategy. Though the aspirations and goals of the strategy are not contentious and to be applauded, the Unite CEC branch are concerned that this is further evidence of the EIJB potentially dancing to the beat of its own drum and that there's a potential for conflicts and confusion in relation to the policies of the constituent employers. A workplace strategy for staff that are already covered by their own employers' workplace strategies adds a further level of abstraction. Proposals such as those to remove the employer's own induction risk further distancing the staff from the organisations they're employed by. This distance risks staff confusion and alienation from the policies and procedures of the employer. A big question lingering over this work is how are the aspirations to be met? Because many of the goals, such as improved wellbeing, reduced absence, better recruitment and retention, depend upon improving the material conditions of workers, conditions that are currently negotiated for the Council nationally through COSLA and locally through the Council for all local government employees. My background's in IT, and the first thing you do before you change any system is you look to see what other things are inextricably linked. You try to find the dependencies, because without this you can't understand the repercussions potential changes might have, and you miss taking advantage of things that you already have. This sort of analysis is essential to avoiding confusion and conflict as the strategy goes forward. It goes without saying that we welcome all attempts to improve conditions for the workforce, and we do support the aspirations of the strategy. However, there must be consideration over how to address the potential conflicts between the measures needed to deliver the strategy and the existing agreed policies of the employers in the partnership. Well, point 2 of the report on the workplace strategy notes that trade union engagement has been sought. We have not seen any, so we'd be keen to hear when and how this took place. It's interesting to note the report's recognition that, I quote, evidence suggests that higher rates of staff involvement lead to lower absence rates, better organisational results, higher commitment and trust. Something we fully support, yet we're alarmed to see no mention of trade union engagement within the strategy in the action or delivery plan, and no trade union representation on any of the working groups. We remind the board that the trade unions are the representatives of the workforce, and that the council has a working together protocol already in place which sets out how it works in partnership with the unions. We'd welcome further information on the level of staff consultation for this work, as we fear there could be a risk that we'll rerun the issues we faced with the proposed care home closures by denying staff an effective voice. Sentences such as ensure staff feel involved in decision making and have the opportunity to ask questions suggest a worrying watering down of staff's effective voice and right to consultation, because there's a gulf between being able to ask questions and having an effective voice at work. And with the council being a fair work employer, it's essential that this crucial principle of effective voice is in place. Thank you.